Hello everybody, welcome to part 5 of Cheating Death 2022. If you're enjoying these videos, please remember to like and subscribe below. If you have any comments, you have any questions, that'd be a great place to post and pose them, and we will get back to you as quickly as possible with the answers. I want to begin this section with the discussion of osteoporosis or bone loss. It usually occurs as we age, and it seems to be more prevalent in women than in men, although not exclusively, believe me. I've known many men to take dives and break bones because their bones are osteoporotic. First of all, what is osteoporosis? In the very simplest of terms, osteoporosis is too little calcium. It's calcium deficiency, because your bone is primarily made up of all calcium. And when you do not have enough calcium circulating in your blood to do the job that it does in hundreds of different capacities, your body robs calcium from your bone to do the job, leaving the bones thinner, more honeycombed, and so forth. Now, too little calcium can come from one of two reasons. Number one, too little calcium. You just don't consume foods that have calcium in them to any significant amount. And you don't take calcium supplements. The second reason is lack of natural digestive acids. All minerals, including and most especially calcium, have to have an acid environment in which to be absorbed and utilized. And it's not what you take in food or supplements, it's what you absorb. And virtually all minerals need to have an acid environment. And that acid environment naturally occurs in your stomach, which has a pH, a very acidic pH of about 4.5 if it's healthy. Over time, as we age, the natural acidic potential of the stomach tends to decline. This results in gas, bloating, heartburn, acid reflux, etc. And over time, it results in mineral depletion of the body, including the mineral calcium. There are also a host of trace minerals that are absolutely essential for the absorption and transport of calcium back to your bone tissue. And when those trace minerals are missing from the calcium supplement or from other supplements or from diet, you don't get the transport of calcium ions back to bone tissue. Other reasons, of course, are hormonal changes, which can affect the transport of calcium, and lack of exercise, because we know that exercise increases bone density through resistance. At our research institute, we have a program that has been incredibly effective, not only for halting or stopping bone loss, but actually increasing bone density over time. We use a highly absorbable calcium, which includes calcium citrate and calcium malate. There are no less than 7 clinical studies that show that this form of calcium, together with key trace minerals, can actually increase bone density, not just stop its loss, but can actually increase bone density over a 2-year period. There are nutrient cofactors that are necessary for optimal calcium absorption that we mentioned earlier. Those include vitamin D, magnesium, boron, manganese, zinc, and copper. And in more severe cases, we often use strontium as well. The second thing you need to do is make sure your digestion is working. If you suffer from belching, bloating, burping, heartburn, acid reflux, feelings of fullness after meals, the chances are you are suffering from a gastric acid deficiency. because when your gastric acid or your stomach acid is significant and sufficient, their food digests effortlessly. If this is your situation, then you need to take a good digestive enzyme along with betaine hydrochloride in order to stimulate the body's production of gastric or stomach acid once again, helping to ensure that not only your protein foods, but your minerals are properly chelated with acid so that they can be absorbed at the cellular level. Some of the other things that we often use, folic acid, B6, B12, vitamin C, vitamin K, and as I mentioned earlier, in some cases, strontium, as well as zinc. Should you have any questions about osteoporosis or about anything in this series, please comment and list your questions below. Also, don't forget to like and subscribe to all of our videos. We have many series of videos coming up. And tell your friends to subscribe. You can't tell if one of these days I talk about something that changes their life, and you will have done a great service. When we return, we will be talking about digestion and absorption.